So the thoracic surgeon plays a very important role in education. And this means education of medical students, surgical residents, fellows, and often means education of the general public and all sorts of medical staff. So this involves often a series of lectures or conferences, and where we might be asked to give a lecture on the nature of lung cancer or how the disease is treated. We might give a lecture to the medical students, which is more basic and more preliminary, whereas those with a surgical resident or a fellow would be more complex and involve topics that would be pertinent for their behavior in the operating room, where they would work with a thoracic surgeon in terms of their training program. So it's a very important part of every thoracic surgeon's role. I think you've probably heard about treating lung cancer and esophageal cancer, so I thought I'd explain some of the other indications for thoracic surgery. We all are born with 12 ribs and a sternum and a vertebral column, which creates the thoracic cage. And that cage holds all the vital organs, 2 lungs, the heart, the thymus, lymph nodes, trachea, and so on. But it's really constructed of bone and cartilage. So it's subject to all the diseases of bone and cartilage. First of all, people can be born with a defect in their chest, which requires the aid of a thoracic surgeon. For instance, some children are born with the sternum caved in and pushing on the heart, and this is called a pectus excavatum. And then there's a pectus carinatum, which is the opposite. These type of deformities require the thoracic surgeon to sometimes correct the bony structure and sometimes work with the plastic surgeons to put an implant in to correct the defect. And then the bony structures may be involved with tumor or malignant disease of the cartilage or the bone. And this might be a sarcoma, osteogenic sarcoma, and often involves resection of a portion of the chest wall, which have to be replaced, sometimes with the patient's own muscle and other times with a prosthetic graft. So that involves a malignancy. It's usually treated in our hospital by the sarcoma group. So we participate with the group and we all plan the treatment and coordinate the surgical resection with perhaps radiation therapy or chemotherapy.